Stem cell therapy. Some say the medicine of the future has finally arrived. Doctors and patients swear by results, citing actual tissue regeneration and repair. The excitement swirls around the ability of stem cells to reproduce and allegedly heal damaged tissue and cure degenerative diseases. But it's this power of proliferation in an unregulated environment that has critics cringing. Still, stem cell clinics continue to crop up, with a growing number of doctors applying stem cell therapy beyond substantiated science, promising treatments for grave conditions, all unproven.
If you go online and say stem cell and therapy, more likely than not, somebody will be saying to you, if you give me $50,000 to $150,000, I'll treat you with your own stem cells that can make any cell type in the body. We have a magic way to do that. The answer is, so far, nobody has shown that scientifically.
People with irreversible, even fatal and chronic conditions, for example, Alzheimer's, become so desperate that if a doctor's a good salesman, they will entice patients with the promise of curing their chronic or terminal disease, and these people will pay $50,000, $100,000. And again, it's a sham and a scam for the doctors, but it's just a con game again.
Practitioners of commercial treatments that have not done valid science, valid, safe clinical trials, valid, safe, FDA-overseen developments, are frauds. This is the greatest danger to anybody seeking stem cell therapies.
This might be considered a non-traditional method, but we've seen success in research and in patient anecdotal cases. I think in about 5 to 10 years, regenerative medicine will actually be the norm for primary treatment for a lot of ailments, not just sports-related or connective tissue-related, but people who have heart disease, people who have Parkinson's. I think patients will benefit from stem cell therapy across the board, and I think in 5 to 10 years, we're going to see this as a primary mode of treatment.
I think this is truly, metaphorically, the tip of the iceberg. There are studies, scholarly studies, being conducted all across the country to answer important questions about how we use these tools to the greatest advantage to our patients, the safest and the most clinically advantageous way that we use them. My hope and my belief is that over the next 10 or 15 years, we're going to make great advances in the treatment of a number of diseases. I'm very hopeful.
So which is it? Has medicine finally found its silver bullet? Or is this just a 21st century version of snake oil? Experts caution we don't know what we don't know yet, and a tap on the brakes is warranted. Because stem cells are harvested from the patient's own body and, for the most part, not manipulated before being re-injected, practitioners peddling miracle-like cures have evaded regulation and continue to prey on the public.
So what some of these unethical medical practitioners do is they offer this type of therapy that's not safe, and they do it off seas. So that would be a case of just really researching and honestly staying within the United States. I speak with doctors nationally every day, and for the most part they're just very much concerned for the safety of their patients, and that what they're doing is going to have some potential benefit for their patients.
As surgeons, we look at medications, injections. If that fails, don't come back or have surgery. So now we have that in between. Now you have the opportunity of treating your own body with your own body's products. It's absolutely incredible.
So the idea using stem cells is basically using the omnipotency, if you wish, meaning the ability of stem cells to develop in different kind of tissues and to integrate within host tissue into the tissue, whatever is warranted, for example, in the heart into myocardial cells, and by thus replacing scar tissue and contributing to the contractile function of that particular organ, especially in the heart.
Stem cell therapy and the brand new field of regenerative medicine are still in the earliest research stages of infancy compared to other branches of traditional Western medicine, but they hold the potential to cure ailments beyond our imaginations.
So regenerative medicine is the use and study of cells and therapies that come from tissues that we use as grafts to try to help regenerate and heal damaged or degenerative tissue in trying to promote the tissue's normal function.
Regenerative medicine is a field that overlaps with the stem cell biology field, and the idea is that there are many diseases and injuries which will cause degeneration or loss of cells within a tissue. And the entire goal of regenerative medicine is to be able to harness stem cells or other cells in the body to convince those tissues to regenerate or rebuild or repopulate themselves.
Medicine is going to become something where you come in, you bring your body, your stem cells, your physiologic failings, and then we recreate and recapitulate that and can heal that almost as if there's no universal medicine. It's just a medicine about your particular makeup, your particular genetics. I mean, I think that is the most exciting thing about it. I find it a little bit scary, actually, but I do think it's exciting.
The story of the birth of stem cell therapy and regenerative medicine began with Dr. Ian Wilmot's pioneering research at the Roslin Institute in Scotland.
One of the things we learned early on is that there's a cell type in the result of an egg being fertilized. Now, normally that happens that the egg floats down toward the uterus where it meets up with the sperm to be fertilized. And while it's still floating free, it divides 5 to 10 times. And it's a ball of cells. Scientists call it a blastocyst.
That cell type, that ball of cells, binds to the surface of the uterus and receives instructions to start making the embryo, which becomes a fetus, then becomes the adult. Dr. Wilmot was the first scientist to take a fully adult mammal and successfully clone that animal, meaning he was able to recreate an exact duplicate. And it all began with a sheep named Dolly.
If you think of the developments in medicine that have occurred in the last 50 years or 100 years that we all take for granted, like anesthetics, antibiotics, organ transplantation, and the contribution that they've made to human health and well-being, then we're very confident that in the future there will be even more opportunities than have been developed in the last 100 years. And together we look forward to contributing to some of those new developments.
When Ian Wilmot made Dolly, the sheep, from a cell taking from the tissue of the sheep, they took out its genetic information and put it into a sheep egg that had its own chromosome removed. That gave rise to that blastocyst stage which Ian Wilmot implanted and gave rise to Dolly. That proved that a cell that's in the body could be reprogrammed back to an early stage, and that it could even give rise to clone humans.
There is no compelling medical need to clone humans. The bulk of society is against it, and all of the responsible scientists and physicians that I know who are in the field are firmly against it and support a ban on reproductive cloning of humans. Our interest is to take the biology inherent in cloning animals and learn how to clone cells and tissues for therapy.
So we're not going to clone humans. That's against the Nuremberg Code. But what was clear was you could make embryonic stem cells from them. And now they have the genetics of the person they came from.
We're building on basic science which has been done at Roslin, which led to the birth of Dolly and the opening up of this whole new area of nuclear transfer technology, and collaborating with people who happen to be in California, but science has to think globally these days, who have the different technologies, and it's by bringing these together that there will be these new opportunities.
Once we really understand the biology behind reprogramming, the fundamentals that allowed cloning of the animals, and apply that to human cells, we can generate stem cells that will be matched to every patient who needs new cells. The real big idea here is the ability to create tissue-matched cells that would not be rejected, and which we could differentiate into any cell that your particular body needed to treat your degenerative disease.
So just what are stem cells? They've been around since the very beginning of our earliest ancestors, but it's just relatively recently that we've found out what they do.
There are about 10 to the 14th power cells within the adult human body, and most of these cells are very specialized, differentiated cells that are responsible for the functions of our organs and tissues. But there's a rare population of very specialized cells that are tucked away in niches in a variety of tissues throughout the body. And these are the stem cells, the immature cells that have the ability to continuously divide and create new differentiated cells on a daily basis within our bone marrow, within our brain, within our gut, as well as a variety of other tissues. A stem cell is a blank slate. It's a cell that's very, very immature and has the ability to turn into a wide variety of other cell types.
So stem cells are fairly undifferentiated cells that have the capacity to divide and also to create other tissues in the body, other cells and tissues.
Injecting these unique stem cells into humans with degenerative disease or injuries to affect tissue repair is still in its infancy. There is no standardized knowledge because there have been no large-scale clinical trials. However, the results of small-scale clinical trials and all early indications on individual patients are most definitely promising.
When I would jog, I thought maybe I had not stretched enough or had pulled a muscle to the point that I could not walk like maybe 10 feet. And so I decided that I better seek out some medical care. And they said, oh my goodness, you have vascular peripheral artery disease.
So in peripheral artery disease or critical limb ischemia, what happens is that the main arteries coming down to feed blood into the foot get blocked. And so the blood cannot get down there and the tissue starts to die. There's incredible pain, the nerves are dying.
Since you have, I guess, 3 main arteries going down your leg and 2 of them are completely clogged, they would have to take my left leg off. And I'm asking them, how far do you take a left leg off, a leg off? And they said it would probably be right below the knee.
What we want to do is to use the adult stem cells to open up those collateral vessels and get the blood down there another way.
I did the stem cell, it was a blind study, and I didn't know if I had placebo or stem cell at that time, and a year later they told me that I had gotten the stem cell. And I've been able to walk, jog, bicycle, skydive, but it's just been making a tremendous difference in my life.
Jeff Scappa is a very interesting 60-year-old patient with degenerative joint disease of both knees.
Make a long story short, so they give me an MRI on my knee, and from there they told me I had a 60% tear in my meniscus in my MRI. I'm 61 years old, so if you go out and play hard, your body's going to end up feeling it. Now, I was also going to Vietnam. I do some real extreme, let's say, type of sports stuff. And I was all set to do the surgery. I was set the next morning to do the surgery, and Graf says, we end up deciding that we're going to put stem cells in my knee.
We've now injected his knees twice over the last year, and he has long periods of relief. I'm very pleased because he's a very active guy and always participating in various extreme sports, which he continues to do as a result of the stem cell injections.
So the stem cells have been incredible. And then through also Dr. Graff, through other injections, I've done PRP, which is the spinning of the blood with the stem cells. And I would say on the knee, they worked amazing.
Platelet-rich plasma, otherwise known as PRP, is a form of regenerative medicine treatment where we take someone's blood from a peripheral blood draw and we spin it and we isolate the platelets. Those platelets contain growth factors that when re-injected into a damaged tissue organ can help promote healing almost tenfold and try to regenerate healthy tissue.
And whatever it does its thing. So the knee did really well.
A lot of professional athletes who need to get back to their game quick are turning to stem cell therapy to help promote healing. So even patients who've had surgeries or athletes who don't want to have surgery or don't necessarily need it are using stem cells to help get them back in the game faster and help promote healing for whatever injury that they've had.
You know, my shoulder was a situation where I've had 2 surgeries, labrum tear, rotator cuff tears, had to have that done twice. So, you know, I heard about this situation and said, wow, let me take a chance and see if it helps.
So when I have patients that come to me, they say, oh, I heard such and such, who is a professional athlete, has had this treatment. Can you tell me about it? Would I be a good candidate? And so I have a lot of patients that come to me because they've seen these professional athletes on the news have had stem cell therapy.
I fell in my kitchen and shredded my meniscus on both knees. The pain was so excruciating. I was plus 10 on a scale. I was told that I would need a total knee replacement. I kept hearing more and more things about stem cell. This was the new way to proceed with an injury, with stem cell.
Well, Roberta's a 60-year-old female. She came to me with bilateral knee pain secondary to severe arthritis. She had meniscal tears in both of her knees. She wanted to seek other treatments besides surgery. And so we discussed stem cell treatments as an option for her.
The first round of stem cell, they took it from my hip and they injected it in both of my knees. And PRP, which they spun that also, cleaned it up and re-injected it into the knees.
She initially came to me with a 10 out of 10 knee pain in both of her knees. She is now 0 out of 10 pain and has her function back and has almost no pain now.
I had so much energy, I felt like I was 30 again, having my high energy that I haven't had in 5 years.
The idea is that those cells adhere to damaged tissue, and the environment around the cells help hone them in to form and regenerate new healthy tissue.
Several studies have been done worldwide in different countries, whether it's in Germany, in the United States, in Israel, all over the world, using different forms of stem cells in order to try to replace or regenerate damaged tissue.
My practice is involved primarily with the care of spine disease. I'm excited about the prospect of treating people who have disc pathology, either because they have annular fissures, tears in their discs that hurt, or degeneration of the discs.
I've been suffering with my back for the last 3 years as far as, painful. I mean, it's been stiff for many, many years. My 3 herniated discs, and one of them at least is severely degenerated. So I did a lot of research, and I realized that a lot of the athletes were going to Germany and doing a lot of the stem cell treatment. So when I was told about the stem cells and the opportunity to possibly regrow the area between the discs, I was there in a heartbeat. I didn't ask questions.
We're seeing, even in patients with significant pathology, we're seeing a reduction in their pain and an improvement in their level of disability. And that's very, very promising. What we're doing in regenerative medicine is truly the tip of the iceberg. I'm excited about the fact that the paradigm is shifting away from just treating symptoms to actually helping people heal themselves.
Regenerative medicine incorporates the body's own natural healing cells, essentially rebuilding and regenerating tissues such as muscle, bone, ligaments, and cartilage. In essence, this medical breakthrough uses the body's building blocks to repair tissue where initially it was not able to do so.
So rather than providing a drug or a pharmaceutical agent to try to fix that problem, we use stem cells to actually regenerate and repair the tissue. Now, regenerative medicine also includes things like using gene therapy or using other types of therapy to reform or regenerate tissues in that capacity.
The goal of regenerative medicine is to be able to harness stem cells and other cells, then have them integrate with damaged tissues to regenerate or rebuild or repopulate themselves, and ultimately to repair damaged or degenerated tissues.
And I think with regenerative medicine, we have an opportunity to reverse the course of the disease, or at least slow it down and perhaps even heal people. And that's very exciting because it's something we haven't experienced in the field of pain management.
What we don't know at this point is, of course, what does it mean clinically besides symptom improvement. But keep in mind, this requires a large number of patients and long-time follow-up, meaning over several years, and we really don't have the experience over several years yet. But what we do have is, of course, the knowledge from individual patients, the anecdotal results, and our own cohort where we do different functional measurements, and every single patient we have treated in the last several years with stem cells had at least some degree of improvement.
Now you have the opportunity of treating your own body with your own body's products. It's absolutely incredible. My success rate is well over 95%. And that 5% really is a person who absolutely will not try any surgery and will give this a shot knowing that they're not going to be fully better. So, 95%. And the results have been incredible.
In my practice, taking all comers, so I have patients that range from about 15 years old to 94 years old, I've had about a 75 to 80% success rate. But that all takes into consideration the degree of arthritis, for example, that occurs in 94-year-old patients, and then I have younger patients who heal much quicker. So across the board, I would say about 75 to 80%.
And where you see the dark.
So overall, it's an extremely promising procedure using stem cells combined with other cells sometimes with regard to try to improve function, to regenerate damaged tissue, making stem cells really the most promising adventure in modern cardiovascular medicine.
Some doctors are using stem cells judiciously for conditions appropriate to the pace of science, but others promise miracle cures for devastating conditions without any scientific testing. Critics say it's unscrupulous, even in violation of the oath every doctor takes, since there's no evidence stem cell therapy works on things like paralysis, autism, or diabetes.
A consumer, a patient who's a consumer, really needs to be their own advocate, educate themselves when they're seeking such treatments. There are several mostly offshore charlatans, I would describe them as. They are offering stem cell treatments for deadly diseases, people that are very critically ill and really have no hope, so they'll try anything. And so they entice them to these resorts, these stem cell or regenerative medical resorts.
Doctors doing it anyway aren't doing it on the cheap. Because insurance companies don't cover these untested treatments, suffering patients fall prey to predatory practitioners. Bills can be in the tens of thousands. All this occurring while the U.S. Food and Drug Administration, or FDA, watchdog turns a blind eye, apparently unable or unwilling to keep up with the medical movement.
Due to the fact that stem cells are tissue products, they aren't drugs. So the FDA cannot approve or disapprove them It is their job to control them and make certain that they're safe for use with people. They're considered experimental, but it is the FDA's responsibility to make sure it won't harm anyone. But the loophole is that they're tissue products. They are not drugs. So that is why doctors can do it under these experimental guidelines.
By purifying blood-forming stem cells, we have been carrying out clinical trials with those pure stem cells since 1996. It moves slow because no pharmaceutical company ever had as a therapy a cell before. The FDA and the regulatory agencies in other countries never had to deal with cells as therapeutics.
The one potential concern associated with using a stem cell is that it has the ability to divide indefinitely. These are immature cells that can divide and differentiate, and we need to make sure on a disease-by-disease basis that the cells that we're implanting to repair a tissue are no longer rapidly expanding upon implantation, which could lead to, for example, a tumor. So that's a safety consideration that the field has been really focusing on to ensure that we create extremely safe therapies.
Several months back, a gentleman who had received stem cells in 3 different overseas places, and he had tumors develop around his spine, which eventually paralyzed him. And they went in and they found very rapidly growing tumors from what had been embryonic stem cells placed in his body.
There's also a religious and bioethical debate still raging about the use of stem cells, one type in particular, embryonic, that some people consider to be a living being.
Embryonic stem cells are derived from discarded embryos, leftover embryos, and these have come from in vitro fertilization efforts in the country. There are about 400,000 frozen embryos in fertilization clinics across the country. A lot of these are going to be discarded. They're quote-unquote leftover embryos. Some donors have decided to give those cells to investigators so that they can convert them into human embryonic stem cells. So that's the area in which there's been the most bioethical discussion.
The controversy is beginning to subside because there are so many other types of stem cells available to conduct research, and actual use of embryonic stem cells is already on the decline.
There are really two types of stem cells. So there are the pluripotent stem cells and then the adult stem cells. The pluripotent stem cells were originally the embryonic stem cells, and those have been very controversial over the years because they're made from fertilized eggs that would be thrown away in vitro fertilization clinics. Since that has the potential to be a human being, that is incredibly controversial. Instead of that type of embryonic stem cell, we now use induced pluripotent stem cells. So Shinya Yamanaka got the Nobel Prize for developing these amazing cells. We can take a little sample of a patient's skin, add some factors that turn it back to pluripotency, which means it can become any tissue, any organ.
Currently, with the ever-increasing demand, another challenge within the field is how to create a system to manufacture or mass-produce these cells in the levels needed to be able to treat very large patient populations.
Just to illustrate this, in the case of Parkinson's disease, there are about 1 million to 1.5 million patients unfortunately suffering from Parkinson's within the US right now. We know how many cells may be needed to be implanted into the brain to have a therapeutic effect, and if you work backwards to how large the culture system needs to be to grow these cells, it can be measured in football fields worth of surface area. We're talking about hundreds of football fields worth of cells. So we need better systems to manufacture these cells.
There's also physicians that just seek poor quality sourcing because they want to save a few bucks, charge the patient many $1,000s, and maybe save $300 or $400 or $500 themselves in their pocket. And they're getting such a poor sourcing, a poor quality sourcing that doesn't have a good level of quality control. And so it's really not benefiting the patient at all.
With governmental regulatory agencies always trying to catch up to fast-paced technological advances, It is no wonder the current laws governing the use of stem cell therapy can be confusing. The FDA does not approve of any stem cell procedures offered to the general public because no large-scale clinical trials have been conducted. However, the FDA allows stem cell therapy for the general public as an experimental treatment, at the very least acknowledging the positive small-scale trials that have been conducted.
Well, right now there are dozens of clinical trials going on regarding stem cell therapy, and I think in the next 5 to 10 years, the FDA will adapt and adopt stem cell treatment as a primary mode of therapy because it carries less risk than surgeries and has been shown to have success with repairing tissue, repairing organs, and patients across the country have had very good success with stem cell therapy.
Doctors using stem cells as a medical panacea face formidable foes in the persona of academia. University researchers insist purity of the scientific process via large-scale clinical trials is vital. They say standardization of protocols and procedures is necessary prior to unleashing the technology on a mass scale. Without it, they say, doctors are essentially conducting human experimentation on an unsuspecting, hopeful public.
You did it. You did great.
Yay. I have people saying, well, this is hocus pocus. And that's the naive person. I have so many skeptics coming to me say, hey, there's no research behind it. There is research behind it. I mean, there's a Mayo study from 2 years ago that has an 80% success rate for bone marrow-derived stem cells for knee arthritis.
So when patients come to me and ask about stem cell therapy, I tell all of them it's still considered investigational and experimental. However, there are multiple trials that have shown good results with stem cell therapy.
Stem cell therapy is not an approved therapy in the United States, nor in other countries. On the other hand, we have enough scientific data as well as enough clinical, partly anecdotal, evidence showing improvements. Improvements with regard to functional capacity of the patients, meaning patients feel better after stem cell therapy, as well as improvements in other regions of the body.
So for me to not offer it to my patients, I think would be an injustice. My goal is to serve my patients to the best of my ability, whether that means traditional or non-traditional methods. This might be considered a non-traditional method, but we've seen success in research and in patient anecdotal cases. And so for me to withhold it from my patients, I think would be a disservice.
To do a therapy, which anybody would say was an experiment, not a therapy.
Okay.
And they're claiming that it is so good that they can charge you for that therapy. That's inappropriate. That's not in line with the oath we all take as doctors to do no harm.
If I have the power to offer my patients a therapy that I think can help, even though it's considered investigational or experimental, then I will offer that to my patient, especially when you're avoiding more aggressive treatments such as surgeries that have far more risks that come with them. And so when I take an oath to do no harm, I give the patients all the treatment options. And so if a patient wants a certain treatment and wants to be educated on it, my job is to educate them. And if they decide that they would like to go through with the treatment, I would offer it to the patient.
I remember at least 5 patients within the last year who were sent to orthopedic surgeons or podiatrists for amputations of toes, feet, or the whole leg, whom we injected with stem cells. In one particular case, in fact, the perfusion improved so much that the patient who was sitting in a wheelchair for years now walks with a walker, but he can walk.
The final answers will be resolved as we look into the future and see how patients do over a significant period of time. And of course, that's what we're all hoping for and we're all studying now in various forums across the country. Obviously, if we have things that we can use that will change the course of their disease and perhaps even heal them, it's good to get this into the mainstream as quickly as possible.
We are moving toward trials, but we have to be rigorous. We cannot fool ourselves that cells that were cheap to make and easy to grow and easy to transplant will in fact be the cells that regenerate. That's the problem we're in. The commercial instincts outdistance conservative medical treatments. It is very important that this field, just like all other biomedical fields, are built on a rigorous scientific basis.
So the stem cell field needs to conduct research in a way that we create very efficacious and also very safe therapies. Because, folks can make claims that aren't necessarily substantiated and based upon very rigorous scientific investigation.
Patients know about that. Patients read about this because all those data are over the web. Even though it's not part of large-scale clinical trials, even anecdotal data play a major role if it's you or me fearing losing a leg.
We have a lot of patients that are doing their own research and coming to me and asking me about it, of course, and then they're telling their friends and family members about it. There's still a large portion of the population that is just not aware of this. When they hear about stem cells, it sounds like space-age medicine to them. They don't really believe that it's here. And although the research is still building and there's lots of studies going on now to prove its efficacy and to show good long-term benefit, we are trying to get it out to folks that this is something that is available now.
In some states in the United States and some countries, the oversight of regulation that usually protects patients against fraudulent therapies is incomplete.
Again, this is not an FDA-approved procedure. That's all considered strictly experimental. We do this under strict protocols, and patients have to sign. Of course, they know it's experimental. There's no proof of the concept. There's just a belief in the concept, and there's data supporting the concept.
I feel like this is a time in medicine, almost like when we came up with vaccinations and antibiotics and anesthesia for surgery. This is a huge step, and I think that in the future, we're only going to see this field move further and further.
If I told you you've got a shoulder issue and I said, I could take care of you with minimal downtime, I could treat you with your own body's products, you would jump on that in a second, I hope. I believe in orthopedics now. 50% of the surgeries that are being done are unnecessary, being obsolete with this technology that's handed to us. 50%.
Developing these novel treatments that are right around the corner. And so for people with diseases that can't be cured right now, I'd say just hang on a little while longer. We are working so hard, we are trying so hard, and we will get there.
When governmental regulatory agencies are up to speed on how to regulate stem cells and allow research and development to proceed unhindered, then large-scale clinical trials will follow, as will technologies to grow stem cells in mass quantities. At that point, the sky's the limit.
In the future, I can see somebody going into a hospital, getting tested for their tissue compatibility factors, and then having doctors go into the freezer, pull out a vial of stem cells that matches the tissue of that patient, and then differentiate those stem cells into the right cell type, into the hepatocytes to repair the liver, into the cardiomyocytes to repair the heart, into the dopaminergic neurons to try to treat somebody for Parkinson's disease, and then implant those into that patient several weeks later to be able to repair their tissues.
When we meet again to talk about our progress, I think we'll be at the point of having demonstrated we can generate heart tissue for your heart that won't be rejected, or islet cells for your children's diabetes, or bone marrow cells for kids with leukemia who can't get a transplant today because there is no donor.
Years from now, I expect we will have significant therapies for many cancers and many genetic diseases through stem cell therapies and molecules or antibodies that were discovered because we could get out the stem cells.
We believe that we can integrate therapies that will, for the first time, permanently cure degenerative diseases, which today have no therapy. We're talking about diabetes, stroke, atherosclerosis, heart attacks, Parkinson's disease, spinal cord injury, a long list of diseases characterized by cellular failure.
The new therapies that I am certain will come, and have already in part come from stem cells, is you transplant them once. It's a single treatment for life. That will change medicine. That will change the economics of health care.
The goal of stem cell therapy now is actually to educate and direct those stem cells well enough that we create an entire organ, like a heart or a liver. And that's the true dream, because right now things like organ availability actually seriously limit our access to treat people with serious organ failure. And there are people now and groups that are actually able to form entire organs in situ, in one area. And that is a tremendous area for growth in stem cell therapy.
Having seen what stem cells have done, I can imagine maybe in 50 years, we'll be able to generate and regenerate organs such as livers and hearts and kidneys for people who are on waiting lists for those organs that desperately need them, and maybe be able to provide those patients that have no other way of getting transplant organs to give them another chance at life.
The way the current system is with organ transplantation is, the big issue is rejection. What stem cells therapy promises and hopes that we're going to be able to achieve one day is to be able to grow these organs without the immunogenic response, so we can transplant them and not have to be in some type of immunosuppressive therapy the rest of their life. And this would be a game changer really for people that have had organ failure and are a requirement for transplantation.
In terms of human medicine, then we will be able to change animals so that they produce, for example, proteins needed to treat human diseases like antibodies or hemoglobin. Or at some time in the future, we would hope to produce organs from farm animals to transplant into human patients.
I could see in the future a time where we could use the stem cells to actually regrow tissue, organs, and the plastic surgeon's job will be much more of from a reconstructive standpoint to almost of a technician of taking the organs out of a package and putting them into the patient.
There's a lot of research going on in our laboratory. We are trying to make bone, create new bone from a mixture of proteins and stem cells, and that would make bone grafting, hopefully, at some point obsolete. That would be a huge step forward, so the ramifications would be really very profound.
I often think about if we are able with regenerative medicine to cure Parkinson's and stop cancer, understand the cancer stem cells, will everybody live to 120? And so that's my vision for the future. Can we cure every ailment that's hurting and killing people? And then what does society do? That's the question. Do we have room and resources? We're really at the cusp of a brave new world.
I don't think anybody can imagine what it's really going to be like in 5 or 10 years. What we've seen in the last 1 year was unimaginable 5 years ago. There are new technologies that are literally happening every single day. Just research that's going on today that was never even imaginable 6 months ago.
So to this point, I've offered some cautionary points for patients seeking regenerative medical therapies. And again, a patient needs to be their own advocate. And it requires research, finding out about a doctor's credentials in order to not only stay safe, but to receive maximum benefit from a regenerative medical procedure. Because not all therapies are equal, and not all physicians have equal level of skill. Beyond that, not all tissue sourcing products are of equal stem cell quality.
This isn't your typical treatment. Re-injected stem cells, for better or worse, will most likely stay with you to some degree for the rest of your life. How far and how fast the treatment should be made available to the public is, at this point, guesswork. And as governmental bureaucracy proves incapable of keeping pace, the unsuspecting public falls prey to harmful nonsense.
So you need to find a qualified physician who has been trained in these procedures and who can educate you. Seek someone who can teach you about the benefits, and do your best to find some of their referrals, some of their testimonials, and the results their patients have had. I advise anyone seeking the treatment to be aware, be your own advocate, and become educated about what you're seeking.
With stem cells, the medicine of the future has finally arrived. Panacea or poison? For right now, it may be both. Proceed with caution has never been so true.